Okay, good evening everyone, and welcome to the Health Overview and Adult Services Scrutiny Committee. First of all, I'd like to welcome all members and officers, of course, but particularly our partners who have joined us this evening: Fiona Noden, Andrew Bolton as Acting Head of Commissioning, Gabrielle MacDonald from the Care Homes Association, Melissa McGuinness from Strategic Commissioning, and Jill Green, Director of Nursing, Greater Manchester Mental Health Trust, and of course our own Helen Lowy, Director of Public Health. So good evening to everyone. Okay, item 1 on the agenda. Mr. Mulholland, I don't think this is really relevant as we are not meeting in a normal manner.
That's fine. It's correct, Chairman. It's fire evacuation, health and safety procedures doesn't apply on this occasion.
No. Item 2, declarations of interest. Are there any declarations, please? No declarations. Thank you. Item 3, Mr. Mulholland.
There's no urgent business, Chairman.
Thank you. Item 4, apologies for absence.
Yes, Chairman. I've got Councillor Abdullah, Councillor Peel's in place, and I think Councillor Eckersley-Fallon as well.
Thank you. Can I just crave members' indulgence, please? I intend to take item 8 on the agenda after the minutes on item 5. And could I remind members, of course, that if they can please mute their microphones and switch their cameras off. If you do wish to speak, if you just hand signal or put a request into the chat box, speak, then I will call you. Okay, item 5 on the minutes of the previous meeting held on the 5th of February. Will someone who was present at that meeting please move those as a true and correct record?
Yes, Chair. Councillor Bagnall, I move them as a correct record.
Thank you. Are these minutes agreed? All in favour, please say aye. Aye.
Aye.
Thank you. So we move on now to item number 8, which is the coronavirus update. Now, I know it is listed on the agenda as a verbal report, but you actually have some slides which you should have had today. And I think the first presentation is from Fiona Noden, the Chief Executive of Bolton NHS Foundation Trust. Welcome, Fiona.
Thank you very much. Thank you for the introduction.
So just to clarify, Chairman, and John Duckett, we need the next slide, please. It's not the work programme one. It's the Health and Care C-19 one. That's right, thank you.
That's right, John. Okay, Fiona, whenever you're ready, John will open the slide.
Thank you very much. If you're ready, John. Okay, so thank you for allowing me to speak today. I've been the Chief Executive of Bolton Foundation Trust since the 1st of April, so I came into post just as we were in the middle of the pandemic. So I want to say a really big thank you to the whole of the system for the support that we've achieved and how we've managed our patients through the last few months. I think the health and care system have pulled together fantastically well to cope with COVID. Our care homes and the hospice have been truly part of our local integrated response, and they have all been significantly impacted, as has the community. Our hospital capacity was able to deal with COVID-19 demand, but only because we planned for it and we paused all our other activities. There's some real good stuff that's come out of this. So we've had some significant improvements where we've seen rapid conversion from our face-to-face outpatient appointment to telephone or video conferencing, not just in the hospital, but in all health and care settings, including GPs. We've delivered the 24/7 crisis mental health response ahead of the long-term planned timescale. And we have been working with the GM Clinical Assessment Service that have been taking calls from 999 and 111, directing them to make sure that patients could have local support. So there's been some really good work across the whole system to make sure that we were safe. From a challenges point of view, it's been a really tough for all health providers and for our communities and for our local our staff. So almost all our activity in the hospital has been paused, reduced or moved. So we did a huge amount of work moving people elsewhere to keep them safe. Our routine patient waiting list will continue to grow, specifically around diagnostic tests and for surgery, until we can make sure that those pathways are safe. We have continued to provide high priority services, including cancer and other high priority cases, so those patients still receive treatment. We've seen that the demand for services significantly reduced during the early days of the pandemic, but the demand is rising slowly, and it's broadly back to the pre-COVID-19 levels for health and care. From our community services, primary care and social care, they're expected to see a rise in demand due to restarting, due to the backlog and the impact of interrupted care on people's health. And we are planning for a significant increase in the level of people who will access mental health services. We're also planning the largest flu campaign that we've ever experienced to make sure that our patients, our staff and our communities are safe and able to cope with the further potential around the second wave. And I'll pause there now if there's any questions regarding the overall response and learning.
I would ask members, please, if we could have the full presentation, and then perhaps if you could make a note of questions as we go along, and then come back. If that's okay, Fiona, we'll come back to you. Is that all right?
Certainly.
Okay,
thank you very much. So if we can move the slide on now, please. So I'm going to present on behalf of the Bolton NHS Foundation Trust. So if we can move on from the holding slide to the learning from the first wave slide, please. So we've had significant learning in the last few months. We've seen how we've supported our patients, our families and our staff. We've learned across the whole of Greater Manchester, and we've made sure that we've had mutual aid both across Greater Manchester and across the Bolton system to make sure that all our PPE was available to both the hospital, and we supported the hospice as well. We've made sure that PPE has been available in community settings, and so there has been no staff that haven't had the correct PPE. We've provided pastoral care both for our patients, for our families and for our staff, and that is ongoing and will continue as we see that the mental health and psychological support for people rises. We've had consistent, clear communication both internally and externally across the whole system, so that's an area that's worked really well, and I think our staff and our citizens have been had clear communication that's been supporting them to make the right decisions. We have changed a number of our staffing roles, so all our staff have been redeployed during the early stages of the pandemic to do very different roles. So, for example, we moved a number of people from outpatients and from paediatrics to support our critical care unit, so that there's a communication from and into critical care. All our orthopaedic staff became staff on critical care, so to make sure that we could support the staff that were there, the staff that went off sick, and also to make sure that they supported each other. We've developed new ways of working. For example, we've got the glaucoma service moved out of the hospital site into Waters meetings, so that we could make sure that there was socially distanced for those vulnerable patients. So we've continued to provide services there. We have been working on clear COVID-like and COVID emergency pathways, and this has had a significant impact on our capacity to deliver services. So, for example, our endoscopy unit, we're currently reduced our activity by almost 40% in endoscopy, because it takes a length of time to put on PPE, it takes a length of time to take off PPE, it also takes a length of time to make sure that the rooms and the air exchanges are clean and safe for the next patient that comes along, so we do not cause hospital infections. We've been successful in our testing programme. We've achieved quick testing, and we have made sure that pathways are in place both for testing of patients and testing of staff. and we've had great system working both in Bolton and across the whole of Greater Manchester, which is certainly going to set us in good stead for the next slide, please, which is, are we ready for winter, and are we ready for a second wave? We are very much planning for a second wave. I think we've seen with the recent restrictions in Bolton and Greater Manchester and significant restrictions in Blackburn that there is a second wave, and it's how do we best prepare for it. So I know that our health and welfare for our patients is in the right place. We will have to quickly be agile enough to work differently again, but we've got good learning from the first wave. We're better prepared, we're much more knowledgeable. We've got consistent deliveries of PPE. We've got really good systems and processes in both in the hospital, across the Bolton system and across the Greater Manchester system. We're currently upgrading our ICU to make sure that that is safe for the second wave, so it will become a critical care unit. We've got safe oxygen capacity, which has been a significant problem in the first wave, and we've learnt a lot from that. We also made sure that we had enough beds both in the hospital and across the community services to make sure that we could deal with our patients appropriately. And we managed to discharge 96% of our patients into their own homes, which was a great piece of work that our integrated discharge team led on, which started in the very early days of the pandemic. And we have made sure that we've got psychological support for our staff. Our staff have seen some really difficult things. They've had to deal with some very difficult occasions, and we've made sure that our staff are supported to be able to do the jobs that we need them to do. Our biggest challenge in wave 2 will be retaining our cancer and elective patient pathways. And we also know that our patients have delayed coming in for treatment because they are worried about being infected with COVID. And there is a very real risk to health if we do not retain our cancer pathways. I think patients will be harmed because they are not accessing treatment, and the cancer they've got will be a higher grade by the time we do access treatment. So we've got an awful lot of work to do to make sure that we support our communities in accessing continued support. On that note, I'll hand over to Rachel Tanner, who will talk about the Bolton Integrated Care Partnership. Thank you very much.
Rachel, your Microsoft muted.
Thank you. Just waiting for the red to go round as well. There we go. So I'm here to speak to you as the Managing Director of the Integrated Care Partnership, which is a new role. And I just remind members really that the Integrated Care Partnership is an alliance of providers, which is adult social care, community health, our voluntary sector, housing, primary care, police and Greater Manchester mental health. We very much have an ambition around delivering care closer to home and in our neighbourhoods. So at the beginning of COVID, the Integrated Care Partnership with the foundations there came together to lead the bronze response. The bronze response is the emergency response in terms of the pandemic and how we would operationalise many of the different pathways we had to. What we saw very early on was that we had a clear directive nationally to cease a lot of the activity, both from a community health perspective and a social care perspective, and redirect our resources to maintain the essential community health services in partnership with primary care and social care. Through this, we saw a lot of our staff across the board being redeployed into the crisis response hub, into our testing pathways and supporting our care homes. So we collapsed a lot of our teams into a central integrated function. As Fiona's mentioned, we saw primary care move to virtual consultations, like many of the other services going very digital and electronic, with a call first approach, creating both kind of those light COVID pathways and hot clinics. The integrated care partnership from both a social care and health perspective supported the setting up of the helpline. So there was a national directive around supporting the most vulnerable, and we worked very much hand in hand with the council around the humanitarian response with our VCSE and housing. And what I'd say is our housing partners were one of the first in there, knowing which were the vulnerable families and the vulnerable adults to link into that hub. And then we saw the VCSE, and the volume of volunteers we had in Bolton was truly magnificent, both through the Good Sam and already our existing through CVS. We also had primary care and our community services and specialist services making contact with thousands of people who were receiving letters because they were shielded or vulnerable, to ensure that they got the care, the medication and support and emotional support that they required. As Fiona mentioned, we successfully supported 96% of our people from hospital back home. We had a directive in kind of end of March with new discharge standards, which were quite challenging, but we managed to create an integrated discharge hub. We brought admission avoidance and falls therapy together and actually created a single point of access into health and care. Something we thought would take us years to do in the ICP, we managed to do in 8 weeks. So we also rapidly implemented aspects of the neighbourhood model through technology, through alternatives to care with the better links to the VCSE. And also our care homes were a key priority in that. Working closely, and you'll hear more from Gabrielle and Andrew next, around how it was really tough, but we had to learn from each other and see what worked, but very much around identifying a named GP per home, teams going in, our nurses and advanced nurse practitioners going into the homes around end of life care, and our hospice in reaching too. We also, as I said previously, we had to mobilise testing, something, we've done flu testing before in outbreaks and stuff, but this was a scale above and beyond what we had experienced. So the testing was for both staff from an FT perspective and also for key workers originally through the Bolton Wanderers site, which was really positive, and then wider to kind of more than the essential workers and the public. We've still got a strategy ongoing, which we might hear more from Helen in public health. But also we over 90% of people in receipt of social care have received a review through this period. We saw many families coping to levels we didn't think they would, and people actually taking control of their health and well-being through this. But there was a number of people, which was a challenge, who cancelled their care, either through fear or through other family members picking that up. So certainly something that we are mindful of as we go forward, and also seeing that our care homes have got the greatest level of vacancies we've seen in terms of sustainability of the market. And I'm sure Andrew will pick up more next. If we can go on to the next slide, so I then can move on to learning. Is it there, John?
It has moved over.
Okay.
ICP learning.
Oh, there we go. Thank you. I just wanted to flag really that the first learning was some of the outcomes for people on a positive note was we did see increased independence with some individuals. We also saw an increased connection with our voluntary service, and our communities responded amazingly well in terms of looking after each other. The good neighbour stuff and the digital connections, all ways which actually were positives to come out of this, whilst there was a great level of stress and impact as well in our communities. From a workforce perspective, our workforce were really flexible right across the partnership, and actually you couldn't tell now that they work for different organisations, which is a real strength of pulling together with a common purpose. But the pace of change, I think, was incredible, and also that staff had autonomy to make decisions and move quickly, and we need to harness that going forwards. From a digital perspective, remote access to systems, virtual MDTs, and identifying kind of that actually there are some people in our communities though where they are digitally excluded. So it's not a one size fits all in terms of learning going forwards and how we can reach out to having a mixed offer. Partnership goes without saying really that there's quite a bit we need to learn from in terms of the OD support going forwards in terms of recovery and how we shift that culture and harness what we have had to do. We have looked as a board to refocus our priorities, and I think actually what we said is that the priorities don't change, how we get there changes. As Fiona said, the second wave is something we're very much thinking about in winter, and how do we get back our kind of activity from both a community health and a social care perspective, and how we sustain some of the new pathways and ways of what we've done in COVID, so we don't lose that opportunity. I'm also concerned that actually our staff have worked incredibly hard and need a break before we kind of hit that winter period too. So our wellbeing offer is key. I think we'll also need to take some learning from what worked in terms of discharge pathways from hospital and what we can do. We certainly were responding throughout to changes in guidance and listening to what was and wasn't working. And I think we could take some learning from that in preparedness for winter. Risks remain though. There is a risk there that actually we responded so well because we had the available workforce because we stepped so much down. We won't be able to do that in a second wave. And we are working on what that demand will be in the community and also the impact and complexity of health and the social care issues of people living with COVID. So all in all, I think as a partnership, there were some significant positives in there, but certainly some learning as to how we're moving forward. And it's something we are responding to on a daily and weekly basis as we continue to live with COVID, but also see the impact on interrupted care. So I'm going to hand over to Andrew and Gabrielle, who will give you more of a focus on care homes, as this has been a key area for all of us in Bolton that we are supporting. Thank you.
Thank you, Rachel.
Hello, everybody. Can you hear me?
Yes, Andrew, we can hear you, yes.
Okay, thank you. If we could move on to the next slide, please, then. So as has already been explained, and as most of us know, obviously know, it's been an unprecedented time and extremely challenging for care providers, whether that's home care or care homes or other care providers. In particular, care homes have really been challenged. In those early months of March and April in particularly, workforce with sickness and the demands around PPE were extremely challenging, but all providers managed to maintain services. We didn't have any services fail. We did suspend some services such as daycare and respite, and we're now looking at reintroducing those. And as Rachel mentioned, we've seen the most reduction in services around the amount of vacant beds in residential care. A big part of that appears to be linked to confidence. As beds have sadly, as people have died and beds have become vacant, there's a lack of confidence in returning to residential care. And we're also seeing that in daycare, where from an initial telephone survey of people returning to daycare, I think it was approximately only a third of the people wanted to return to daycare at that time, while they were waiting more guidance, really. Okay. I suppose the key thing around the challenges there that are referenced is that we worked very closely together as partners with providers and colleagues from health and other agencies. Probably we've worked, and again, as Rachel's mentioned, we worked much more closely together than we've ever worked. Care homes have been the most impacted. 35 of the 57 have experienced at least one case of COVID-19 has been confirmed, and we've had 111 confirmed deaths in care homes where COVID-19 was recorded on the death certificate. That's around the same as the national average, around 33%, but it's still an awful lot of people. And as mentioned there again is around the workforce and how much that was impacted in the early days. Again, it was quite frightening for staff and managers. It was a very difficult time. And one of the key things that we found to support providers was around good communication in terms of working with them. And we still do regular twice weekly telephone contacts with providers. And we've done regular webinars and even a newsletter. We've offered support both financially and practically. The cost of PPE has gone up exponentially. I'm sure Gabrielle will reference it, but just for a box of gloves has gone up, I can't remember, it's about 4 times as much now. And on top of that, the demands around face masks. So we've been supporting that around the extraordinary expenditure, and that'll be a challenge that for us going forward. In terms of learning, there is lots of learning. We accept that there's things that we can do better. We have worked extremely well together, and we're currently designing a questionnaire for care home providers to find out what has worked well for them and what we should maintain and what we need to improve on should there be a second wave later this year. If I could hand over to Gabrielle, if that's okay. You there, Gabrielle?
Yeah, I'm here, Andrew.
Would you like to highlight anything?
Yeah, I think you've probably covered most of the things on that document, but yeah, I think we have worked really well together. In the early days, I think it's quite tricky. You know, a lot of the care homes did take it upon themselves to start doing things a bit earlier, like lockdown and the use of PPE. But once we sort of found our footing between it, we were all sort of singing from the same hymn sheet. You're absolutely right. The cost of PPE have gone through the roof. They're pretty unsustainable, really. Where we'd be paying £25 for a box of gloves, 10 boxes of gloves, we're now paying £114. So those are the issues that going forward that we need to address as much as we possibly can. The document that you talked about us all working together and finding out what went well and what didn't, I think that's going to be instrumental, really, in case there is a second wave. We all worked independently, so it's good to be able to share these ideas, and then we can face the next wave together. I think there's some other issues, but I think probably not for now. They're probably more for our local authority meeting that we can discuss other things around, mental health of our staff, agency staff, and things like DBS issues that we came across in our place of work. But I think that's it for now.
Thank you, Gabrielle. I'll pass over to the next presenter.
Hi, it's Sue Long here. Just checking you can hear me.
Yes, thanks, Sue. Yeah.
Thank you. I'm the Accountable Officer for Health and Care in Bolton, and therefore I take a commissioning role in the system, as well as supporting the clinical commissioning group and overall system working. And I think Bolton working as a system is probably the summary that I hope you're getting from this presentation today. There are some key points on the slides here for you that highlight some of the things that have been supported through our work. But I think the main thing I would want to underline to everyone here today is how much all of the Bolton Health and Care partners work together throughout the worst peaks of COVID and since, and how much it has really felt, I hope you've heard so far and will continue to have underlined how much it has felt that we're all part of one system. I think it really felt like for the first time, general practices, the hospital, the community services, our social care services, care homes, hospices, we're all part of delivering the same outcomes, all taking action. It was to do with personal protective equipment or other have been good examples of that.
John, Sue seems to have frozen there actually.
Sorry, I think I lost connection.
It may be easier, Sue, without your video. That might
Yeah, I've turned it off now. I seem to have a bad internet connection. So in terms of working, first of all, a great focus was on supporting general practices to work in a very different way, to change their standard operating procedures over a weekend in order to operate a call first system. And that's something that will continue not just in general practice, but in many of our services across health and care, asking people to call first so that they can be directed to the right care, but seen face to face if that's needed and best for their care. You've heard about the care homes response, and a good example of some of the more detailed response we supported people in their own homes was to support personal assistants who are funded by personal health budgets but employed by individuals in order to get training and personal protective equipment that they needed. We also supported the community out of hours pharmacy arrangements to ensure that people got the medicines they needed in very quick notice during the COVID period. There have been some excellent implementation of things that actually were planned for another year from now, and one example of that being the 24/7 crisis support lines for mental health that are now available, and we are committed to continuing. So I think it's fair to say that, as I said, the whole system really worked together, and that the all of our partners, including the voluntary and community and social enterprise sector, played a critical role by working together. I think there's another slide. So I think, as I said, continuing a call first approach to many services will be something that you can expect from across our health and care system from now on, and that's a national NHS plan, including a call first approach to emergency department attendances. Continuing to support ongoing integration, as has already been picked up by Rachel, of social care and health services, and that greater role of our voluntary sector, and supporting really to make sure that we change the way we do things and continue to improve as quickly as we did during the times in COVID. So I hope that that's been a useful update, and I'll pass on to the next presenter.
Hello there, I'm Jill Green, Director of Nursing for Greater Manchester Mental Health. We're a specialist mental health trust, and we're extremely proud to provide mental health services in Bolton and work closely and collaboratively in partnership, as colleagues have mentioned earlier. The way everyone has worked together has been absolutely and continues to be fantastic. This evening, I'd just like to share with the committee some headlines around innovation, but also some of the learning from a mental health perspective. One of the areas we have particularly learned very quickly is actually the use of technology in delivering services. So, for example, we have a service which is a primary care service who cares for people with mental health distress, called Improving Access to Psychological Therapies. We're now providing that service 100% virtually, and we've had a recent evaluation undertaken by Manchester University very shortly, which suggests that the effectiveness of the service is as effective as face-to-face. So, for example, some of our therapists live in the Dundee and Edinburgh area, but are providing effective therapy to our residents in Bolton. Sue also mentioned a fundamental change in all mental health services of providing a 24-hour, 7-day-a-week helpline using an 0800 number. Since the beginning of the COVID crisis, the team have been managing anything between 50 to 70 to 100 calls a day. 70% of the service calls are from people who are already accessing specialist mental health services, but now that that's transcribed using the 111 number as well, about 30% of our calls are from people who've never used a mental health service before. Again, looking at innovation, the team managing the helpline are all working virtually from home and receiving specialist supervision to enable them to deliver a good, compassionate service to our residents in Bolton. Next slide, please, John. Thank you. Thinking about the learning, one of the areas I particularly want to mention to the committee this evening is how stark health inequalities have been over the last few weeks, and the impact of the virus not only on our BAME colleagues in the health system, but on our BAME population as well, and the sensitivity towards the virus as well. Thinking about that, thinking about the potential of a second wave. The use of PPE, and I know that colleagues have mentioned about the delivery of PPE, which, to be fair, in the early days was incredibly difficult, but also thinking about delivering safe, effective mental health services, how important communication is, and thinking about if you have a nursing profession who is wearing full PPE, how you communicate to someone who may be hallucinating or maybe misinterpreting stimuli, and how we've needed to adapt practice to enable our staff to wear effective PPE, but also, most importantly, provide compassionate communication to our service users. One of the areas we've developed very quickly is being able to give effective physical mental health care to our service users. We have, during this period, sadly delivered end-of-life care, both sensitively for our service users, but also for the relatives as well. Within that as well is thinking about our communication with our service users and carers, and particularly our carers in community. When we consider mental health services, 85% of our service delivery is in a community setting. So thinking about our carers who may be caring for someone who has dementia or a long-term mental health condition, and the impact for them during this time as well. Thinking about as well what we've learned during this period and how we are preparing and sustaining for a potential second wave. And within that as well, mental health services have been particularly planning in respect of demand and capacity. And there is no doubt during the last 6 to 8 weeks, the increased mental health distress that we have seen in our population, not only for our service users with long-term mental health conditions such as schizophrenia, but also as well for all of us in different ways, and the type of mental health distress we've all experienced and continue to experience during this time. And thinking about as well the effect on the economy, we may be preparing for people to be prepared to be redundant from work, etc., and the impact that can have on a person and their families. One of the things we are developing as well, which is becoming more apparent with COVID, is a person who has been very ill with COVID can now have sadly experienced a particularly mental health trauma with what they've experienced with COVID. For example, someone who's been vented and then had a period of recuperation and is now at home recuperating. What we are seeing are symptoms such as acute post-traumatic stress disorder. Is no question about it, that is apparent within our community. We're very alert, we are managing the additional demand and capacity, but there is no doubt we are preparing very, very quickly for that. And also thinking about service delivery, which I'll know will be affecting our colleagues in social care and Bolton Foundation Trust, where the impact on test, track and trace over the coming months, that, you know, perhaps you could have an experience where you have a whole team that may need to self-isolate, and thinking about and preparing for what that can mean to service delivery in the coming months. Thank you. If I can now hand over to Helen. Thank you.
Thank you, Jill.
Thank you. Can I have the next slide, please, John? So, public health and the Public Health Directorate's response. I think it's fair to say what COVID has highlighted is the role that public health does across an entire system, and the support that it provides and offers right across not just health and social care, but across all components of society. So what public health has provided throughout the whole of the current COVID pandemic is very much public health leadership. All of the work that's already been discussed today, public health has been working hand in hand with absolutely everybody to ensure that information is available, the guidance is interpreted, the guidance is applicable, and what does it mean in our for our local communities. And when I talk about communities, I am talking about, for example, into our care homes, into our schools, into our special schools, within our particular areas. And through that, we've provided a large number of briefings, especially on a weekly basis and sometimes daily basis, to our senior management team, as well as to elected members and to numerous boards. Also, just to say, in relation to public health leadership, we also established all of the gold, silver and bronze structures that then lead into and feed into the local resilience forum. So really supported that whole infrastructure from a health protection, outbreak control, management. We've also, one of my consultants in public health has been leading a multi-agency COVID-19 data cell that's been right across the system, again, health and social care, but also with partners with police, fire and rescue, and into the response cell as well, to really feed and understand where we need to be putting our efforts on our focus throughout the different parts of the pandemic. And I think that's really important to say, because obviously initially it was very much focused around ensuring we've got all the information for our shielded population, or also other people who needed a response from our response hub, and the data intelligence actually supported that. So we now have the epidemiology data and intelligence, so that we can inform and actually enable various strategies, our response and our recovery. And I do mean recovery from this phase as well as future phases. As I mentioned, our shielded and vulnerable humanitarian support, and it was absolutely fundamental in ensuring that we've got everybody supported through that, providing SITREP reports, so situational reports, feeding back into the local resilience forum, but also into our local gold and silver command here in Bolton. We now have public access to data for COVID. The link is there, and there's a specific section on coronavirus for people if they want to see that for Bolton. And it does also include presentations and weekly updates as to where we're at from the situation in Bolton, looking at both our cases and our morbidity and our mortality. We've very much got trying to support a prevention and engagement with our communities, with our services and our businesses. We've done a number of webinars with the voluntary sector, as well as our local businesses, as well as various services right across the whole of the sector. And it's, again, working very closely with Rachel and Andrew and others for the care homes, working with Bernie Brown and Paul Rankin with the education and heads there. And as I say, other parts of our different communities. We've also done some webinars for our ward members as well, which I'm sure many of you have been on. We've developed and produced an outbreak control plan. And so we've got a COVID-19 outbreak control plan that is actually available on the website if people do want to have a look through that. And we've also established a health protection board, of which I chair, that really brings about the test, the trace, the contain, and the enable for COVID-19. So that's around ensuring we've got a strategic approach and an operational approach to testing. Where should we be focusing our testing, the tracing, contact tracing, working with both the national team as well as the GM Greater Manchester hub, as well as our local hub. And again, we've got our own SPOC there, so our own single point of contact for contact tracing. The contain is really key and really important, which links very much into the engagement agenda. So it's about ensuring that we do prevent a COVID from spreading, but also we contain the virus for any outbreaks, and we enable people, enable the work to progress. Throughout the whole of COVID, we've been providing specialist public health advice and also guidance, and interpreting the guidance and offering that support back, working very closely with Public Health England, as well as other key partners, to ensure, as I say, the advice is interpreted and is as clear as it possibly can be, which is sometimes a challenge. It has been a high level of demand on the team since February. So before our first case, but since the February, public health team, of which there's only 12 of us, we've been on a 24/7 rota to be on call. We respond to people's queries outside of hours, whether again it's a school query, whether it's being informed of a first case. We are there, and again from a contact tracing point of view, we've got a 24-hour call rota in for the public health team. In addition to that, we have actually redeployed some of our staff to support parts of the system. So, for example, the humanitarian response. A few members of our team started in the humanitarian response, and one is still in there. And also, one of our members of staff oversaw the University of Bolton Stadium testing site for when it was initially established, prior to being handed over into the Integrated Care Partnership. But again, it's demonstrating the flexibility and also the support right across the whole of the agenda. The other side as well, just to say, not just in the health and social care side, but we're also working with our environmental health officers, who again have been supporting us from a contact tracing perspective, but also supporting what's happening out in our communities and with our businesses. Obviously, the day job has to go on as well, where we have continued with the day job. We still commission public health services. We've had to work with our providers to ensure that those services have been COVID safe throughout all of this. So our substance misuse services, sexual health services, health visiting and school nursing provision. And of course, our infection prevention control service as well, and working very closely with them as they again are supporting right across all of our communities to support to prevent outbreaks. So again, some other activities that we've continued to lead on or to progress with has been things such as the public mental health, and as Jill said, you know, this is a really key area. We know the impact of not just COVID, but also the consequences of the management of COVID will have a significant impact on public mental health. So we've been trying to ensure that we progress with that agenda, adverse childhood experiences and violence prevention, as well as active travel and stop smoking. So again, that's just a few examples of the day job that we've continued in the background, whilst also supporting and leading on the COVID agenda. And again, planning for the medium and longer term. So yes, we are coming out of our first wave of pandemic. but we are anticipating increases going forward, especially with the winter planning and supporting the planning around that through our outbreak control plans. And just also say that as part of the outbreak control plans, we've also tested them and used the Civil Contingencies and Resilience Unit to help facilitate some exercises so that we actually test on a multi-agency basis those outbreak control plans that we have, so that we can help support again into the longer term and the wider and indirect impacts of COVID. And obviously a key part of all of this planning as we move forward will be for the seasonal flu campaign. Okay, next slide please. So the reflections and learning. Obviously, as everyone's been saying, communication is absolutely key. How we keep everyone informed of a very rapidly changing picture and guidance is a challenge. It continues to be a challenge because things do change, as we know, very rapidly, both nationally as well as locally. And we're trying to really support and ensure that we have strong communications, but we can't underestimate how much learning we need to ensure goes into this, but also our communication is applicable for our local residents. Engagement is again another key aspect, and I have separated it out on purpose from engagement, because it really is about engaging with our community, winning the hearts and minds of our community, having messages that do resonate with all sectors of the community. One size doesn't fit all, as we know, and how do we develop that, building the trust and supporting interventions. So that's one of the biggest reflections, and again really key to our health protection plan, outbreak control plan as we go forward. We know that we need prompt access to good quality, timely local data and intelligence. It has been a challenge for us at the beginning because we didn't have that access to that data. It is starting to come through now. We now have access to patient information, identifiable information. And that happens at the end of June, bearing in mind that the first case was in March. So again, you can understand some of the challenges that we've had on that. But again, as a learning, it's really important that we know and appreciate that we do need that good quality data and intelligence. Another reflection we've really got to think about, and again, this isn't just from a public health perspective, this is for across us all as a whole system, that this isn't even a marathon anymore, it's an ultra marathon. It's not a sprint, it is an ultra marathon. COVID is going to be with us for a long time, and how do we adjust to that? How do we adjust to it from our ways of working, our culture, and our socialisation, and how do we support each other through what is essentially a really big culture change, but it is remembering that it is that long haul for this. And again, as has been said in other parts of this presentation, is really reflecting and supporting the staff, not just in public health but all across the whole of the sector really. Because what we don't want is burnout, and we really want to support the emotional well-being of all of our staff and our residents as well. Another reflection is around the messaging. We know the guidance changes quickly, as we said before. We know that sometimes the information changes, and that is also because the more information as we know about the virus itself progresses, and we have a better understanding of how the virus behaves, what patterns are. Then we need to keep those messages fresh, and we need to protect against fatigue and also complacency. Because unfortunately with COVID there is absolutely no room for complacency, and actually how do we manage expectations as well? Yes, we want to get back to normal, but I think we've got to ask, what is that normal? And again, another reflection is what COVID has done has really amplified the challenges that we all face in relation to inequalities. There's been a significant amount of work that's been done both locally and nationally that outlines the impact that COVID has had on our more disadvantaged population for a whole host of reasons, and how do we need to mitigate this. So for example, people in more disadvantaged areas may not be able to socially distance as easy as somebody in a more affluent area, because they are having to do the face-to-face or high contact employment, working more than one job, and how do we support families, and how do we reduce the inequalities? So again, it's more important than ever to keep the core public health business moving forward, to ensure that we do address inequalities. And again, as we reflect and think forward, using the data, using the intelligence, and when I say intelligence, I also mean the messaging from our communities as well, not just the epidemiology, but the stories from our communities, to really think and reflect on those health inequalities and how do we mitigate them on that long-term impact of COVID going forward, especially for our young population as well. As they're leaving school, the next generation coming through, how's COVID impact on all parts of our communities, and again, trying to plan for future waves of COVID. So thank you very much from me. That's it from my slide. So thank you.
Thanks, Helen. I'm going to go on to questions. Can I just ask, please, that depending on what the topic is in the question, could the relevant officer try and pick that up, and we'll answer it. We'll try and get through them in that way. The first councillor wishing to speak is Councillor Cunningham. Councillor Cunningham, please.
Thank you. Fiona, nice to meet you, albeit virtually for the first time. Fiona, you referred to the pausing of other activities, and I don't think it's any secret. We all know that this will, over the next 5 years or so, result in some deaths that we wouldn't have otherwise had, particularly perhaps those who are expected to be diagnosed as far back as February now, and are still waiting in areas like, and you've already referred to this, colonoscopy and endoscopy, because of the particular problems associated with that. I believe that these services have returned or restarted, but at a much reduced capacity, and will also not be offered, and perhaps this is one of the parts of the question I'd like to get cleared up, will not be offered on a first come first served basis, i.e. those that have been waiting the longest may not be offered the first appointments back. And also I have heard that they may not be offered the appointments at the hospital where their local hospital, which was originally intended, but this could be moved out through Greater Manchester, as the appointments now will be considered on a Greater Manchester basis. So somebody in Bolton could end up having to go to Rochdale, etc. You did refer to, in terms of capacity, you mentioned we're running, I think, at 60% of capacity, so a 40% reduction. And I just wondered how recent that figure is, as I'd already sort of had it suggested that on average, say in Bolton, you'd do 12 appointments a day, and they're currently doing 3. So I would have sort of equated that to 25% capacity, some of which would, of course, include people with suspected cancer. I realise that you've referred to other cancer pathways being ramped up, but it's not easy to ramp this up because of the particular nature of the investigations and the cleaning of the surgeries and all that has to be done. Do we have then an actual, I know there's no actual guarantees, but a projected timeline? At the moment, I think we're working on something like to get back the 3 months we've lost and the backlog cleared. It could take up to 2023, 2024, assuming there are no further waves of COVID reoccurring. And I believe that that this is obviously a great worry to those that are affected by it. So could you give me a little bit more clarity around that? Thank you, Fiona.
Thank you, Councillor Cunningham. Just to reassure everybody on the call, our endoscopy service has continued throughout. We've been providing endoscopy services throughout the whole of the pandemic and through all the months that we've been responding to it. We have never stopped doing endoscopy services. We have reduced our ability to do that because of to keep our patients and our staff safe. So I just want to make sure that everybody is reassured that our endoscopy services have been running, albeit at a reduced capacity. You raised a number of issues, one regarding capacity and one around patients accessing services. So my ask to you all is to make sure that any patients who are referred to us are able to come for their other activities. So if I go into this in a little bit more detail, if you bear with me a moment, please. Our endoscopy service sees a lot of cancer patients. Those cancer referrals have continued to come through to us, and we have continued to see those cancer patients. However, there are many patients who have been referred to us who we have tried to schedule, who have been refusing to turn up for their appointments because they are scared of coming for their appointment because of the risk of COVID. So we have got two pathways, specifically in endoscopy and in our theatre environments. So we have an emergency pathway, which indicates that we can keep our emergency flow safe. So that's patients who come through our emergency department or who require very rapid access because they're deteriorating. And then we also have what's called a COVID light pathway. The COVID light pathway, we ask our patients to be tested prior to any procedure, and we also ask if they can be shielded for a number of days prior to any procedure. That's often difficult for people, which is why we've introduced a testing mechanism to make sure that the test is negative before we put any patients through a procedure. So I'll pause there while I move on to what you suggested. Potentially patients could go to other organisations for their procedures. So we very much do deal with our patients in chronological order, but we also deal with our patients in emergency order too. So if a patient is classified as a high criteria or high incidence of having a disease, those patients will be offered the first appointment. Other patients will be triaged accordingly to make sure that their appointment is dealt with at the appropriate time. Throughout the pandemic, we have, as I suggested earlier, been supported across Greater Manchester via mutual aid throughout all organisations. So we have been supporting organisations as well as others supporting us. And there may be a point in the coming months where we will not be able to offer certain surgeries because we will not be able to offer a COVID light pathway. In those incidents, we'll be making sure that our patients do not and are not are able to access services as other patients in Greater Manchester. So, for example, a patient who requires a hip operation may have to go to Wigan for their surgery if we are unable to offer that surgery in Bolton, because we wouldn't want any patients in Bolton to be at detriment of having surgery if there was something that we weren't able to provide. In the same respect, it might be that Bolton, because we've been using the independent sector to continue to provide services on our behalf, is able to continue providing services for other organisations as well as ourselves. So that was the answer to the first question. I hope I've explained that in detail. You mentioned about, and your second point around the capacity for emergencies, and the fact that it does take us a length of time now to make sure that the environment is safe for our patients. The pandemic will be with us for a number of years, as Helen alluded to previously, and this is something that we will need to get used to and make sure that we can provide safe pathways for patients and make sure that our staff are able to deliver those pathways in a safe environment too. So our capacity will be reduced. It was very much reduced in the early stages of the pandemic, but we've been increasing that capacity throughout the last few months, and we will continue to do that through August and September and October until there is a case where we need to pause activity again if there's a second wave or if there's a reason why we are having difficulty in providing urgent care for our winter pathways of patients. I think that might have answered all your questions, Mr. Cunningham.
Thank you, Fiona.
Thank you.
Thank you. Councillor Howarth, please. Councillor Howarth, please.
Thank you, Chair. Sorry, had to wait for the red line there. First to say thank you very much for all of the description tonight from all the speakers of the achievements for what is about a third of a million people that live in the Bolton Borough. I want to comment on and ask about the first phase of the pandemic in March and in April that involved rapid discharge of patients from the hospital. Some patients went home and some went to care homes. The government has accountability for sending untested hospital patients into care homes between mid-March and mid-April, and accountability for sending hospital patients into care homes who were positive for COVID-19. We can seek to better understand how this period of government policy affected our health and care services here in Bolton, Chair. Because this scrutiny committee, above all other scrutiny committees, is required by government to carry out a statutory function. Other scrutiny committees don't have a similar statutory function, and our statutory function involves review of many health matters, and also insofar as the way that they relate to the rights of the public that are laid down in the NHS Constitution. The Prime Minister did oversee around 16,000 people in the country discharged from hospitals and admitted to care homes between mid-March to mid-April without being tested for COVID. Many care home residents are still living with the consequences of that decision, and many others have ended up sadly dying as a consequence. Excess deaths in care homes due to COVID-19 are above 30,000 people in the country, and excess deaths has affected Bolton. As a consequence of hospital discharge legislation around mid-March, were care homes pressurised at all into receiving patients whose COVID-19 status was unknown? I've nearly finished, Chair. Our committee ought to consider if the government was ordering hospitals to break their own rules on the discharging of patients. Chair, every one of those statistics that councillors have been receiving of rapid discharge of patients from hospital and those who died was a living, breathing person taken often before their time and leaving an empty void in the lives of their families and friends. Scrutiny can be a way forward to honour the lives lost and can provide answers to grieving families. It can be our committee responsibility to have a crystal clear understanding of the chain of events in Bolton as to what happened here, what decisions were taken in Bolton, and what the outcome has been of government legislation and decisions taken in London. I would like to hear a bit more tonight, and I'm grateful for what I've already heard, about the effect of government legislation around the 19th of March that legally instructed the rapid discharge of patients from hospital. I thank Rachel Tanner, for example, and earlier Fiona Noden. I think Rachel described the discharge hub, she described that directive at the end of March, and I'm most interested that Rachel started to talk about their learning. The whole system, health and care system, are learning a lot from the discharge system. So thank you very much, Chair.
Thank you, Councillor Howarth.
Thank you, Chair. I'm happy to take this question. Okay. What I would like to focus on, Councillor Howarth, is Bolton's response to the national directive in terms of the discharge standards, which came in the third week in March. In Bolton, we retained our integrated discharge team, which is social work and nurses within our hospital, and we didn't pull them out to community. So they were in there to support the wards in terms of making the right decisions of where people should go home. And as Fiona said as well, is 96% of people at that time, when we were looking at emptying the hospital because of what we anticipated coming, went home. Of the discharges which did go into care homes, 67% of those discharges were people who that was their home, the care home was their home. And we certainly worked with homes as to if the person was positive for COVID, the home were aware of that, and we supported them through the infection control team to make sure that they were able to contain any spread of that from a person being discharged in their home with PPE, with infection control guidance, in terms of the hand washing, the cleaning. And we saw many homes successfully do that. There was a very small number of individuals who were discharged who, say, within the 2 weeks afterwards became positive. What we can't be sure on is whether they contracted that within the home or within hospital. The number of those were very early on, and actually Bolton was ahead of the game when it came to testing. And what we would say is our infection control team advised homes to try and isolate, irrespective of a test, whether the test was negative or positive, that as somebody is discharged, they should self-isolate them within the home or intermediate care bed for the greatest protection. So I do think that it was difficult. I think it was difficult for us to understand the path of the virus and how that would spread. We knew care homes were our most vulnerable, and our homes did a great job. We did have kind of infections in homes where there was no discharges from hospital. So it's very difficult to say, you know, kind of what was the reason in terms of COVID outbreak in homes. There was many homes where there wasn't a discharge from hospital, and it could have been through asymptomatic staff or symptomatic staff with being infectious before their symptoms arrived. We have seen periods more recently when the guidance changed to full PPE because of community transition, managing the outbreaks, and I think, you know, the homes and the teams have worked really hard to reduce the impact and, you know, and reduce the loss of life. And when we have had loss of life in care homes, the end
Frozen, Rachel.
Rachel, would you be able to drop your video and just we can pick your audio up again?
Hello? Can you still hear me?
Yes, Rachel.
Yes, we can. Okay. Yeah, it's better now. Yeah.
Thank you. I'm back. Apologies. Not sure where I was up to within that, but I would say that the homes, in terms of how they supported end of life care, was exemplary, ensuring that people were supported throughout, bringing in relatives who at points of end of life care to protect them too. So it's very difficult to comment on the standards themselves. What I can comment on is how Bolton responded, something that we did learn on throughout. But I do believe that in partnership between the hospital and the ward staff, the integrated discharge team and our care sector, we did as best we could in what was an extremely difficult circumstance. Thank you.
Thank you, Rachel. Councillor Heslop, please.
Thank you, Chair. I'm looking a little bit further ahead. I think it is relevant, especially given a possible resurgence. But it was announced recently that there is a intended flu jab vaccination of virtually half of the population of the UK. And in my neck of the woods in Kersley, that amounts to about 7,000 people. Now, what I am concerned about is the capability to give the people of Kersley, these relevant people in Kersley, the jab, and how you're going to actually physically do that. There's not many facilities in Kersley. We've talked about a lot of this being delivered in the community. So I'd like to, if somebody could look at that and get back to me and give me some idea of whether this has actually been considered. Thank you.
Thank you, Councillor Heslop. Can Dr. Lowy, I think you want to answer that.
Yep. Do I need to have the red box around me? Thank you. Yeah, you're absolutely right. The nationally, what's happened is NHS England, NHS Improvement have absolutely expanded out the national flu annual flu campaign and the vaccination so that it's a larger cohort. Public Health, along with CCG and other health colleagues, is working really closely to ensure that there is a programme put in place. It is obviously a large expansion, and we are looking at that. We have a multi-agency flu group that meets every single year, and it has already started to meet, and that also feeds into the Health Protection Board. So I haven't got the detailed information at the moment because we're still doing the planning of it to ensure that does start fairly soon. Because, as I say, it is a very large undertaking, but we will be obviously making sure that, again, we've got the communication out there when we have more of the detail and as it's come through, but a lot of it is also being planned at a national level to support the delivery at a local level. Thank you.
Thank you, Helen. Councillor Sherrington, please.
Thank you, Chair. I don't know where I need to send this to, but I just hope that the speakers can pick up on it and decide for themselves. I want to ask about funding, and I know that that's not come up at all tonight, so it might be something that nobody can answer, but here we go. I believe that the government has given some funding to all the towns in the country relating to COVID, and I was just wondering. We've heard about from the care homes to say that they've the PPE which they would normally buy is also rocketed and gone through the roof as far as price is concerned. So I was wondering if some of this money would be used for that. Also, I'm very, very conscious that the people who've had COVID, and I do think that the public need to know more about this as well, that the people who've had COVID, post-COVID, do actually get left with all sorts of different things that are wrong with them physically and mentally. And I do think that there's a cost element that is going to be there as well. And I do think that some of this money should be used regarding that. And also, like I say, we need to actually make sure that the public become aware of all these things as well. The other thing is regarding the testing. I've been told that the testing for the elderly and the people with dementia who are in care homes that was promised would happen is now not going to go ahead. And the testing that is for other people like the disabled and so on, who might be in network houses or whatever, they can be tested, but the price, the cost has got to come to the local authorities. So I'd be interested to find out if that is coming out of this magic money as well. So I do have concerns about how the funding is going to be used, and also is it going to be used for these very important parts. And the reason I'm saying about the people knowing about post-COVID as well is because I was talking to somebody today, because quite simply I've been out today and I've been isolated for I don't know how long, and just on the odd occasion seeing a human being. And I was absolutely amazed how many people are not having masks on their faces. They don't seem to be bothered about putting anything on their hands when they go in a supermarket. And I'm just absolutely amazed about how they just disregard the whole thing. And I was talking to this person today, and she said, well, she said, you do know that Bolton people are immune to COVID. And that is what comes across, is this attitude that Bolton is untouchable when it comes to COVID-19. So I do think that somehow or other we've got to get things across, because obviously what the government is putting across is obviously not affecting people in Bolton. They don't see it's got anything to do with them whatsoever. So I'd like to know, you know, what, if anything, we can do to actually make people understand that that COVID is out there and it can kill them. I don't know what we can do, but we do need to do something. And the thing is, with the flu jab, this is another thing, it worries me, because, you know, they're going to actually have these flu jabs for as many people as possibly can, which is wonderful. You know, I mean, I have a flu jab every year, it's marvellous. However, how do we get across to these immune people in Bolton that this flu jab is not going to cover COVID-19? They still have got the opportunity to get COVID-19. How are we going to get that across? It does really, really worry me. So I don't know who wants to take up these particular issues, but I just felt that it needed to be said. Thank you.
Thank you, Councillor Sherrington. I think Rachel Tanner, please, on the COVID money for care homes, please.
Thank you, Councillor Sherrington. An awful lot there in your questions, but I'm going to particularly focus on the questions around the funding for care homes and testing, and then probably hand over to my colleagues in relation to the wider issues in terms of flu. As Andrew mentioned in the presentation, we have supported through two routes for funding. The first route is in relation to extraordinary expenditure. So very early on, in the 27th of March, we actually opened up to our care sector, care homes and community providers, the ability to put in extraordinary expenditure claims. And this is being funded through a number of routes, which is the money that came to the local authority for COVID, and also others through the NHS route through the CCG COVID monies. And that has supported with PPE as an example. In addition to that, we did receive the Infection Prevention Control Fund, and that was distributed to all care homes for the first wave. The second wave of the money came last week and was distributed, and we are also distributing the 25% now, which we are supporting homes with the additional pressures of testing and the burdens of that in the homes. So the COVID monies and the extraordinary expenditure has got a limit in terms of how far that will stretch in terms of time frame, and we're awaiting if there's any more announcements, but we have distributed all that fund to care homes, and they could use it to support staffing, PPE, any other adaptations they require to improve infection prevention control or movement of staff between homes. In relation to testing, the feedback from our homes is they've already received the testing kits to swab staff weekly and residents monthly, and have started to receive their second month's supply of that. So whilst there has been some communication around it not starting to September, Bolton Homes have actually already started that programme that registered at the beginning of the month in July. So I'm reasonably confident that actually we have got mass testing going on in our care homes. There may be some issues in supply, and that will be picked up in September. But we also have additional support through our Pillar 1 when we have outbreaks. So hopefully the blip in the national announcements won't affect Bolton too much, and we are keeping a close eye on that and talking to our homes regularly on that. So I'll hand over now to Helen Lowy around flu, and then maybe Sue or Fiona would want to pick up the other aspects. Thank you.
Yeah, again, on the the flu vaccine, you're absolutely right. It's really important that the messages are available to people, that and the importance of having the flu vaccine. And I think that's, again, going back to the presentation, the reflections is around both the communication and the engagement, so that we can really support people to have the flu vaccine, especially those people who may not have had it previously because they weren't as part of the cohort to have the flu vaccine. But we really do need to work again with our communities, and that's something that Public Health will be doing as part of an engagement strand, as well as our healthcare system, to ensure that we can facilitate a larger scale flu vaccine programme, and that's for children as well as for adults as well. And I think, just picking up on your other point around are we immune, I think it's a very mixed picture, because certainly there are members of our community who don't believe they're immune, and they are really abiding by the social distancing, the supporting, using the face coverings, and again it's a culture change as to remembering, as remember our coats when we go out, how we got our face coverings, to ensure that we do wear our face coverings on, and so it becomes the normal to put on when we're out in public places, or even within our when we can do visit our family members as well, who we don't normally live with. That might seem quite strange, but I think as more people start to wear the face coverings, it becomes the second nature. I think as well, it's also about the, having that strong infection control messages. It is about washing hands more so than putting gloves on, because again, unless gloves are used very, very appropriately and with good hand hygiene as well, and washing of hands with gloves on, they become as the same as the skin. So that's why, from a public health stance within our communities, we've been really asking people to continue to regularly wash their hands for a minimum of 20 seconds, as well as socially distancing for 2 metres. But if we can't socially distance for that 2 metres, have a face covering on as well. And again, that links back into the engagement work that we're doing right across all of our members of our communities, and working with the voluntary sector, so that it's peer-led to support some of those messages. So hopefully that's answered it in relation to encouraging people to have the flu vaccine as well. If not, just let me know. Thank you.
Does any other officer wish to come in, or can I move on to the next question? I'm going to move on to the next question. Councillor Peel.
Thank you, Chair. I want to go back to the points that the questions that were raised by Councillor Sue Howarth earlier on, because this is an issue that's increasingly worrying me, and has worried me since the beginning. I have asked questions about this in the recovery group, and this is the issue of the infections in care homes as a result of government policy, because there's growing evidence now emerging across the country that this could have been avoided. We've got to go back, but just before I say what I'm going to say, none of this is to do with any health professional in any health or social care setting in any part of the country, including Bolton. These are excellent staff and officers who do their very best under incredibly difficult circumstances, but ultimately must follow the edicts that come from central government. And I want to go back to when this first started, because everybody seems to have forgotten that the original policy of this government, even after what we'd seen in China, was herd immunity. That was the original strategy that they were very seriously thinking of adopting for the UK. Some may argue it is actually the policy being adopted in the US and Brazil at this moment in time, an underhand herd immunity policy. But that was the original policy, and it led to confusing messages, contradictory messages, and I think those contradictory messages are still out there now, but it did also lead to a surge in care home deaths in Bolton and nationally. And we've had the figures, and we've had the figures again today, and those proportions of care home deaths in Bolton are not significantly different from the national average. So for all the professionality and wonderful work and procedures and strategies we have in place, the damage had already been done. And that's the difficult thing, and it leads to the UK having the highest death rate per capita of any comparable country on earth. And there's got to be reasons behind that. There has to be reasons behind that, and one of the reasons I think is because of the strategy to pass the virus onto care homes. And that's not something that I say lightly, because it was, Councillor Howarth mentioned the end of March, but the Department of Health issued an edict on the 23rd of March, which actually said negative tests are not required prior to transfers or admissions to care homes. You know, that's what they said, and the Quality Care Commission, not long after that, has actually started investigating claims that COVID status wasn't even shared. I really hope that that didn't happen. At the same time, government advisors were recommending quarantining elderly people who were discharged from hospitals into what they termed intermediate Nightingale-style facilities before going to care homes for this very reason, and the government chose to not take that advice. And so we led to a situation where patients were discharged into care homes without deaths. We then had the government change of heart on the 16th of April, 4 weeks later, after the infection had been passed on, that patients being discharged would now first be tested. But still, COVID positive patients were still discharged to care homes at a point. So first of all, we had patients discharged without a test. Then we had COVID positive patients discharged at a point when we still knew that the PPE equipment in care homes was woefully inadequate, and a lot of care homes still needed a lot of help with infection control. I don't know if people saw the Panorama programme the other day, but incredibly disturbing things that had gone on and things that were said, and I'm sure there'll be more of this said in the future, coupled with the fact that the government deliberately kept the figures of care home deaths out of the official statistics, and we all remember that. We all remember these figures being kept out of the statistics, so we never actually knew what the scale of the problem was. And now we come back to what we've seen today, which is 33% of care home deaths were from COVID, and I think it's a similar figure of all deaths in Bolton were in care homes. It's something around that mark, 35 out of 57 care homes in Bolton infected. It can only be described, Chairman, as a litany of failures. You know, I don't expect our health professionals to be able to specifically answer this, because it obviously comes back to the Health Secretary, Hancock, who actually, you know, using layman's terms, being sued by Dr. Cathy Gardner, technically known as a judicial review. But the allegation is that the government failings led to a large number of unnecessary deaths, and also that the government made disingenuous, misleading and plain false statements suggesting that they'd done everything they could do to protect care homes. And we know that this simply isn't true. The facts are just coming out more and more. The Commons Health Select Committee Chair, Jeremy Hunt, who's obviously a Conservative MP, has severely criticised the government, saying it's extraordinary that they did this without criticising the risks. And the Public Accounts Committee went even further, saying that residents in care homes were treated as an afterthought. And I think it's a really damaging situation that we're in now. Now people can make their own mind up. They can say that this policy was either deliberate, it was part of a residual herd immunity policy that was still being applied, or it's incompetence, gross incompetence from the government to do this to care homes, knowing full well they were completely unprepared. I don't know what the answers are, Chairman, and there'll probably be at some stage a national inquiry into this specific issue. I hope, but one thing's for sure, one thing we can all agree on, surely, is that questions do need to be asked about this, and questions do need to be answered about this, because, you know, beyond all doubt, the facts are there. It was a deliberate policy to discharge people from hospitals into care settings untested, and then discharged who were tested positive when they knew full well that care homes were not able to prepare for it. If anybody didn't see the excellent panorama expose on this the other day, I recommend that you watch it, but I'm pretty sure that there'll be a lot of follow-ups. Just to conclude, Chair, you know, I'm very, very angry about this, but I just want to make it clear that I'm not finger pointing at any of our wonderful, brilliant professionals and staff who work in this extraordinarily difficult situation, but I am finger pointing at policymakers, because ultimately they have to take the buck. Ultimately, they have to take responsibility for their actions. I will leave you with that, Chair, but I do think that questions need to be asked locally as well and answered. Thank you.
Thank you, Councillor Peel. Rachel Tanner, please, to respond.
Thank you, Chair. And thank you, Councillor Peeler, for kind of acknowledging as well the work done locally between the health and care system. What I would hope is that Scrutiny has seen that we have been transparent with the information and with cross-party all the way through the pandemic, through the Recovery Board, of our actions locally, how we have gone above and beyond the policy to learn quickly in Bolton and respond. I'm not sure I can offer any more kind of information on this matter. I do think it is something that, you know, Bolton as a locality and an integrated partnership and as an ADAS membership will absolutely contribute to any national learning or any reviews that are conducted. But I would say that this is probably something from a political perspective for debate. And I just hope that you are assured by the information that we've provided locally that we will continue to be transparent with our actions, and will strive to learn and adapt and support our care sector and our most vulnerable where we can. Thank you.
Thank you, Rachel. I've got Councillor Madassa Dean, please.
Thank you, Chair. Just waiting for the red box. Here we go. Thank you, Chair. Just before I go on to the comments that I originally wanted to make, I think it's really important, Chair, that the Scrutiny Committee sticks to the questions that can be answered by our local panel of experts who have just gone through probably the most difficult times and still going through of their professional careers. So I think it's really important that, you know, we don't waste their time, and just make political comments like some of us have been making. However, what I wanted to say more than a question was an observation and some comments through you, Chair. I just wanted to, again through you, Chair, just wanted to thank our panel of experts. I wanted to thank the whole system locally, the partnership, and the way it's worked, whether it's been private sector, public sector, people at all levels have gone out of their way to work hard. It's been as we all know, the most difficult time. But I just think it's important to highlight to the residents of Bolton, you know, the hard work that our experts have gone through, and thank them from the bottom of our hearts as a committee to do that. Thank you, Chair.
Thank you, Councillor. I'm just having a. I can't see any more questions. Okay. Well, can I thank all the officers who have contributed to this most illuminating presentation and question session. I think the COVID-19 situation within Bolton, as within any other borough, has been dealt with by our local professionals in the best possible way they could. But I also think it behoves us as a scrutiny committee to do our best to ensure the public in Bolton are fully aware of all the facts, all the questions and the answers regarding how our health services have performed. In our constitution, parts of our remit, Article 16, it says we have the right to establish review panels to look in depth at specific issues with a significant impact on the health of Bolton's residents. So I would like to move from the chair that we set up a special scrutiny review panel of inquiry into the COVID-19 epidemic in Bolton, how it affected our town, and this will be an inquiry that will be member-led. We will announce the membership of the special scrutiny panel as soon as we are able to. And we will look at all aspects and take information from everyone regarding this crisis, and then we will make a report to council, and more importantly a report to central government to at least give them an indication of how this terrible virus affected our town and what we did to address it. So I would formally move that from the chair.
Is there a seconder, Chairman?
I'll second that.
I'll second it.
Who's that? Sorry.
Councillor Mystery, I'll second that.
I'll third it.
It's been proposed and seconded, Chairman. The matter's open for discussion.
Thank you, Mr. Mulholland. I think we can just proceed, if you will, please, to the name vote.
That's fine, Chairman. Proposed by Councillor Donegal, seconded by Councillor Mystery. It's for, against or abstain. Councillor Cunningham. Councillor Cunningham. Councillor Cunningham. I'll move to Councillor Dean. For, against or abstain.
For.
Councillor Radcliffe.
You're muted, Councillor Radcliffe.
For.
For. Councillor Donegal.
For.
Councillor Peel.
For.
Councillor Sherrington.
For.
Councillor Howarth.
For.
Councillor Mystery.
For.
Councillor Bagnall.
For.
Councillor Pattison.
For.
Councillor Gibbon.
For.
Councillor Wright.
For.
Councillor Heslop.
For.
The only other person, Councillor Darvish has left. Councillor Cunningham, are you there? No. Okay. I don't think I've missed anybody out. Do say so, please now. Well, in that case, it's carried, Chairman.
Thank you, members of the committee. Myself and the Vice Chair will obviously let you know as soon as possible as to when this will be enacted and how we actually go about setting it up and dealing with these matters. Thank you.
Sorry, Chair. In addition to that, would it be possible for me to make a comment?
No, I'm going to move on now, Councillor Dean, if I can. I'm going to move on to the committee work programme, please.
Chairman, thank you. Item 6, members have already had sight of last year's work programme and the presentation slide, which Rachel Tanner will go through in a moment. Following this meeting, members, if they wish, they can email me with their suggestions. And in terms of the way forward, it would be the chair, vice chair, myself and relevant officers who would meet, and a proposed work programme would come to the next meeting for members' approval. Thank you, Chairman.
Thank you. Thank you, Mr. Mulholland. Yeah, I think it's important that members be aware that the committee work programme is quite flexible at the moment, as you can imagine, so that if you have any areas that you really feel we should be looking at, if you could email Mr. Mulholland with those areas, we will certainly incorporate them into the committee work programme and then rejig it accordingly as matters are more pertinent, as you can imagine, to the existing situation and going forward. So I would appreciate that. Thanks very much.
So we have, Chairman, just the slide now from Rachel Tanner.
Yeah.
She'll go through.
Thank you, Rachel. Yes, Rachel.
Thank you. If we could have the slide, please, John. Okay, thank you. So this is a collective effort from other key officers on the call across the health and care system around some thematics that we feel would be useful to bring before the committee. As you can see there, the COVID-19 outbreak control plan, and I would say that we are still mid-pandemic and living with this, and that's, you know, consideration of reviewing kind of how we respond to this. There'll need to be regular updates to get a full perspective on how the system has responded. So I would urge that we have this as a live item, but also recognise that we are still mid-pandemic. We've also touched on the flu campaign. So as that progresses, I think scrutiny would be well to consider how well that is being implemented and any of the challenges with that. And also that there are items 3 and 4, there are significant changes kind of on the horizon around the NHS landscape, both nationally at a GM level and reviews undergoing, as well as kind of progression as to scrutiny's heard before around our strategic commissioning and our integrated care partnership, and that we should probably bring an update sooner rather than later on some of those aspects. In addition, the Active Connected Prosperous Board, which also undertakes the health and wellbeing duties, that we would, our Director of Public Health would bring through an update on progress around that, and the Director of Public Health report in connection to the statutory duty there. I think that item 6 kind of also relates to what we've already discussed, but also there is significant transformation required to help people live well at home, shifting from kind of looking at long-term care to looking at enabling people to live well and independent lives and self-caring, and there's a whole programme there. We've also touched on, as Jill has emphasised this evening, the impact on mental health, both on our secondary care services as well as our prevention through primary care too. Learning disabilities is something where I think we haven't necessarily brought anything specific through scrutiny for a while, and I know it was something that was discussed in the programme last year, as was support to carers, which was due to have come pre-COVID. So that's from the work programme that we were able to conclude. And finally, the responsibility of the Safeguarding Adults Board to bring an annual report through. So these are thematics that we would suggest as officers that we will build into and bring relevant updates through, Chair. Thank you.
Item number 7 is the committee remit, and this is for noting, please.
That's right, Chairman. It's just there also to aid members when they're considering suggesting work programme items. And also underneath that are the dates of future meetings of this committee, the next one being the 9th of September. And if particularly all the external members of this Scrutiny committee could make a note of these in their diaries. Thank you.
Thank you very much. Thank you. So that concludes the business of the committee this evening. Can I thank everyone, all members who have joined us, and particularly thank the officers and panel of experts who came along and give such a comprehensive and in-depth focus on how Bolton has dealt with this terrible virus and what we intend to do going forward. Thank you all very much, and stay safe. And if you are travelling home, a safe journey home. Thank you.
Thank you, Chairman.